Why neither mainstream nor holistic medicine rarely helps patients with uveitis. The human body, health, and our wider environment are incredibly complex. Every medical system, including modern and alternative systems, take a similar approach to handle this complexity and deliver improved health to patients, namely, the creation of a highly simplified model of the human body, which allows one to identify key areas that can be focused upon to create a positive effect. This approach is, by definition, reductionistic. Reductionism pervades the medical sciences and affects how we diagnose, treat, and prevent diseases. The holistic disciplines are often aware of their reductionism and can be considered a step ahead of medical doctors. However, several truths prevent patients from improving their health states. Specialists from the same medical specialty will default to treating most patients they see nearly identically. When those patients see specialists from another area, they are often given a completely different regimented treatment approach. For example, an ophthalmologist will typically default to steroids for uveitis treatment. In contrast, a functional physician may default to probiotics. The steroids carry significant side effect risks and do nothing to prevent the uveitis from returning, while the probiotics, in most circumstances, will not address the underlying cause of uveitis. Time and time again, when patients have serious, chronic health conditions, they are met with formulaic protocols, dogma, and box thinking. And the biggest challenge for any patient will always be to find a physician who will comfortably go outside the constraints of their box and training. It is extremely common for patients with complex illnesses such as uveitis, rheumatoid arthritis, and Crohn's disease to see perhaps dozens of healthcare providers from different disciplines in an attempt to regain their well-being. Often this process can take years before the patient, often due to luck, stumbles upon a practitioner who ignores their dogma and addresses the patient's medical needs. These patients are the lucky few, which is part of why we created symptoms.wiki. The reality is that for every medical issue, there are multiple therapeutic models which can realistically bring healing. In an ideal world, every patient would have access to a healthcare provider who is open-minded enough to use an ever-expanding range of therapeutic models, is willing to discern which treatments are best for their individual patient's needs, and the courage to implement these ideas. Symptoms.wiki provides you with knowledge from a variety of different disciplines. We speak with dozens of providers who have treated patients, as well as former patients who are now disease-free for every course we create. Our goal is simple: to provide you with the information you need to recover.